The coronavirus pandemic continues to take a toll on the first responders and healthcare workers who remain on the front lines across the country. Among those impacted are Filipino Americans, who in states like California and New York make up at least 20% of the nursing workforce. Joining me now is ProPublica reporter Nina Martin, who says the toll of COVID-19 on Filipino healthcare workers has left many in the community reeling. Nina Martin, thanks for joining us. First, I want to start by give us a scale of how it is affecting the Filipino communities, how integral they are in American healthcare.
The Filipino healthcare community is an incredibly important part of the infrastructure of the healthcare system in the US. It has been, especially the nursing community, going back for decades. But Filipinos are a really important part of the larger healthcare system too. They're doctors, they're occupational therapists, physical therapists. They work in healthcare settings, in hospitals and nursing homes around the US. We did an analysis at ProPublica of recent census data and found that 1 in 4 adults, Filipinos in the New York, New Jersey area are in the healthcare industry, in some aspect of the healthcare industry, which is staggering number if you think about it. Nurses, Filipinos are more like 4 times as likely to be nurses as any other immigrants in the US. And so what you have is an immigrant community that was trained and recruited to come to the US to fill nursing shortages at different times in our history. They settled here. They had immigrated and brought family members in, and those family members very often have become healthcare workers themselves. So all of these reasons kind of explain why Filipino families in particular have become so deeply rooted in the healthcare industry in the US, and why in a place like New York, that's, the epicenter of the COVID epidemic, it turns out they're also at extreme risk of being exposed to the virus and getting sick and dying at high rates.
What about the ripple effects to all of the people that they live with, their family members? Is there any way to get an idea of how this is spreading in that community?
I think it's hard. As we know, one of the shortcomings of the data collection at the moment is that we just don't have very good data about healthcare workers who are dying. We don't have very good data about racial disparities amongst people who are dying still in many places. Asian tend to be lumped together into the group of Asian as opposed to Filipino versus Chinese versus Korean versus South Asian. So the numbers aren't great. But what we know anecdotally is that there's just huge amounts of ripple effects throughout the communities. And so even when people themselves are not getting sick and dying, their family members very often are.
This story, one of the intriguing parts of your story was that these people are going through this and feeling the effects of it while
Yeah.
xenophobia is on the rise.
I think that, as we know, Asians in many parts of the country have been scapegoated. The Trump administration and supporters have been calling the coronavirus, the Chinese virus. And there's been a big uptick in hate incidents against Asians in general. And Filipino Americans have been targeted along with everyone else. At the same time, even before COVID, obviously, there was a big uptick in anti-immigration rhetoric by the Trump administration, sort of saber rattling around denaturalizing people, for example. And so that creates a problem as well, because the nurses and the doctors and the workers that we're talking about are doing the most, they're in the most vulnerable settings. They're doing critical care. They're at the bedside. They are unable to social distance. And they're often been doing it without adequate PPE, without adequate protections in place. And they are perhaps feeling unable to protest because of fear. There are a lot of Filipinos who have immigration visas in process who, and a great fear of speaking out and hurting the chances of other people in the family to immigrate.
Nina Martin of ProPublica, thanks so much for joining us.
Thank you so much for having me.